Thank you, Dustin. We're going to conclude with one final question tonight, and I'm going to start this question with Dr. Thompson, and we're going to conclude the panel with Dr. Bessler, and then I'm going to answer the question also as the concluding remarks. And that question is, and we've reached that final question, how do we fix the healthcare finance problems? We want to send you home with some ideas of some solutions. You've already had a lot of ideas from this panel and from us as to what we need to do, what the problems are, how do we fix the problems. I think what every one of us has told you is the government is the problem, not the solution. So how do we fix the healthcare financing problems? Dr. Thompson.
Well, certainly that's an easy question to walk out of here with, but there's a couple things that I will broadly mention, and I think the others on the panel might go into a little more specifics, but we certainly face a growing population. And so without a doubt, healthcare costs are going to continue to go up. It's a matter of what are some things that we can do to contain the costs and be a more efficient system. I think there's a couple. I think one, we can remove the tax distortions that we've already talked about. You've heard, I think, tying insurance to employer-based is not needed. There are alternative ways that we can go about rectifying that concern and that issue. It also allows the insurance to be more portable, and so you're not confined to that particular job. The cost of losing your job is not as great. I think one that was certainly mentioned earlier is availability of information. You as a consumer knowing more about your condition, your health status, what are the factors that go into the particular treatment, and making educated guesses as to how to go about pursuing any number of types of treatments. I think one that is really lacking from the forefront is we've got to do things to put more competition in place. There are a lot of regulations that really hinder competition. One that right off the bat is providers from out of state cannot provide insurance into another state. And so simply changing the regulations around state boundaries would immediately open up a lot more competition and would force providers to have to compete with one another. And then I think the final one that certainly has been mentioned already is the reducing medical malpractice suits. Putting less of a burden on physicians to practice defensive medicine and instead being more active in treating what they think has taken place and diagnosing the problem. So those are certainly a broad spectrum of areas where I think cost measures can be looked at and immediately contained and by making some certainly radical changes, but changes that can be done.
Dr. Scioli.
Well, I would certainly underscore everything you said there. I would tell you, I'm going to say something as a physician that might surprise some of you with respect to tort reform. We are actually benefiting from tort reform in Texas. One of those parameters is a $250,000 cap on pain and suffering. Frankly, folks, that's not enough. If I hurt you, that $250,000 is gone like that. That's the ugly truth. You may need more than that. Now, what the benefit of tort reform has been to our system is it allows doctors to come into this state because they don't have quite the fear of being sued. I've never been sued. So here's the deal. I don't practice defensive medicine. Never have. Don't know what it is. I never ordered an MRI that I didn't come back with a positive result. It's a confirmatory test. It's not for me to say, God, I better order this test or I'm going to get my ass sued off. I'm not afraid of being sued. My patients know that. They feel this with me. I'm looking out for them. If they need an MRI, I'll tell them they need an MRI. How much is it going to cost? Let's find a cash price for you. How many doctors do that now? I don't know. I do. It's all part of the big picture. And so we can get skewed one way or the other. You get too far to the right, you're on the rumble strips, and it's crazy. You get too far to the left, you're going to have a head-on collision with oncoming traffic. Stay in your lane and make sense. We can fund this thing by doing some of the things we talked about earlier, but transparency of cost, without that, you can't have a chance. You don't have a snowball's chance in hell. Get that problem fixed, then this other will solve itself with you as consumers and me as a provider. It's that simple. And don't worry about my income. Please don't worry a bit about me. I'll be fine.
Mrs. Ashmore.
Obviously, our concerns are all very much the same with tort reform, tax subsidies, and credits for individuals that need assistance in staying in the private market. Health savings accounts need to be beefed up, not eliminated or reduced. Again, reiterating Dr. Cieli's comments about the importance of transparency all the way up and down the line. Health IT, we haven't talked about much, but that is kind of incumbent rolling into this. Long-term care incentives, big issue, big tax hit or financial hit coming down the future. I would also say, kind of leaning towards or addressing some of the comments that others indicated about the individual market. For those of you that don't know, there really is an enormous regulatory difference between group insurance and individual insurance. And currently, under current law, the group insurance is guaranteed issue on groups of 2 to 50. That means that no matter how sick a group is, I can find a home for them. There's an insurance company out there that will take them. Now, they'll adjust rates some for the medical conditions in the group, but it's a guaranteed issue market. That's not the case on the individual side. We do actually have pretty significant laws in place that govern the portability issue and the pre-existing problem. I don't think when those laws were passed and enacted in 1997 that we anticipated the economic pressures where people would be without jobs for such an extended amount of time, wouldn't you say? So perhaps going back and readdressing some of the timelines inside the pre-existing or the portability laws that are there. Because once you've been insured and that is in place for 12 months, then you can go from job to job to job to job and your pre-existing is taken care of. What's happening is we're having longer gaps in between jobs, so that would be an easy fix. And for some cockamamie idea, when Congress passed HIPAA, they allowed portability of group to group, group to individual, individual to group, but not individual plans to individual plans. Another simple fix. There's a plethora of simple fixes that we can do that will facilitate huge numbers of insureds, get more insureds in the pipeline, and make it way more affordable over the long haul. Again, just know and understand the words, be very involved, do your homework, but there's a lot of very simple things that can be done right now to alleviate a lot of frustration.